Okay, so I'm going to prepare to do a sterile dressing, perform a dressing change on my patient. I'm going to go through their chart and look at the orders, gather all of my supplies that I need, the correct solution, and all of these things. And then I would have pre-medicated the patient about 30 minutes prior to doing the dressing change for the patient's comfort. And I've taken note of any allergies that the patient would have to latex or anything like that. Knock, knock. Hi there, my name is Liz. I'm going to be doing your dressing change today. Can you confirm your name and date of birth? Check and make sure I have the correct patient. How is your pain level at the moment? Better. Great. Okay, so I'm going to first hand hygiene and bring my bed up to a position of comfort for myself. Oh my. There we go. Okay. I'm gonna don some clean gloves. And we'll remove this dressing. So we're going to remove the tape anchoring the skin as to not irritate the healthy skin. And we'll tuck it under. And then remove and assess any color or drainage, odor, things like that, and dispose of that. And then remove the packing that we have, taking note of how many gauze I'm removing, as well as any drainage, color, and odor there, and dispose of that. So now I'm going to measure my wound with my sterile Q-tips and my measuring device here. So first, I'm going to go from cleanest to dirtiest, so we'll start with the depth. Taking note of about 3 centimeters for the depth, and then we'll measure the width. Taking note of about 3 centimeters for the width, and then my length. Taking note of about 14 centimeters for the length. I'm going to dispose of my Q-tip there. Okay, now I would dispose of this also because I don't need it anymore. And I'm going to off my clean gloves, perform hand hygiene, and we're going to set up our sterile field here. Okay, I'm going to pre-open my things. I've got my sterile gloves here. I pre-open my ABD pad for myself. And remove that. I can uncap my fluid there. And I'll prepare my tape ahead of time, so that's all ready. Okay, now I will don my sterile gloves here. First, I'm going to pinch and don my first glove here. with my sterile glove, I'm going to remove my sterile gauze and pour my solution with my non-sterile hand. And then don my second sterile glove. Okay. So now I am going to get my wand and soak and ring. Glove. We'll pack the wound, making sure our packing doesn't touch any of the healthy skin there, so we don't cause skin breakdown at those areas. Okay, and then we'll take our one and our second one. Okay, and then we'll place our EVD pad. At this point, I'm done being sterile because my wound's all covered. We'll remove my sterile gloves. And I would dispose of these. I'm saving them. And then I will take and then I would date, initial, and time my wound, perform hand hygiene. I would dispose of all of my supplies here, and then I would place the patient back in a low and locked position. Make sure they have their call light close by, and perform hand hygiene and go document my findings.